my jaw had shrunk. And so what happened was that I couldn't chew food. And so it got really drastic when I had the Heimlich maneuver done on me 3 times in 6 weeks.
Wow.
And at that point, I came running. I needed help. I couldn't eat.
Felt like you weren't able to chew your food very
No,
well.
I couldn't. I was, no matter how small it was, it would get, some meat especially would get stuck.
Wow. Now, we did a whole lot of work on you back then, didn't we?
Oh, yeah.
Yeah. I remember that you had a lot of bone resorption, and we had to actually, at that time, we took our patients to the hospital.
Yes, I was in the hospital. You took bone from my right hip,
okay.
and you rebuilt my jaw.
Okay. Great. Not a very fun experience for you, I'm sure.
Oh, it was all worth it, though. It's really not that bad when I think back on it. It really wasn't. Okay. I was sore and had all kinds of blue and purple and yellow marks on me, but it looked worse than it felt. So I think I was back to work in probably a week, no more than a week.
Wow, that's fantastic. Well, you're tough. We don't expect everybody to be as tough as you, Connie. And after we did the bone grafts on you, then we came back and did some implant work on you.
Yes, my whole mouth.
And I think that was probably in 1988, so it's 25 years ago.
Yep.
Amazing. That's fantastic.
Yep.
And you've been pretty happy?
I'm delighted.
Okay.
It really, I tell you this all the time, but it really changed my life. I was a teacher at the time. I taught for 35 years in the Orange County Public School System at Mid-Florida Tech. And it was embarrassing when you're in front of a whole group of students. And my students were ages 16 all the way up to 55.
Uh-huh.
And it just, I looked so much better. I could eat anything that I wanted to. I still do. Okay. And it just totally changed my life. It probably took 15 years off my face.
That's great.
At least.
Yeah. Good looking lady.
Because I was looking bad.
Yeah, I tell you, good looking lady now. Beautiful smile on you.
Thank you.
Connie, obviously this thing was very expensive. A lot of time that went through it and all that. Is it? What are your feelings? Worth it? Not worth it?
Oh gosh, it was worth everything and more.
Yeah.
It was, like I said, it changed me. It changed my life. It changed my outlook. Changed the way I feel about myself. And it was worth every bit.
Any regrets about what you've been through? What anything you'd do differently? Or?
I would do it. My one regret is I didn't do it sooner. Before I had 3 Heimlichs done on me.
Yeah.
If I had done it when I first noticed a problem, which was probably a year before I really did anything, I would have done it much sooner.
Gotcha. Okay. Well, it seems like it's worked very well for you,
yes,
and we actually had to come in and replace a couple of those implants.
We had to put, after 24 years, we had to put 2 or 3 more in.
Okay.
But other than that, they're solid.
Great. Terrific. Any limitations on what you're eating?
Absolutely nothing.
Okay, so you're able to...
Nothing's safe on my plate.
That's good. That's great. That's terrific. Well, Connie, thank you so much for spending this time. I think that, as I mentioned to you, there are oftentimes patients that are apprehensive. It's scary.
Yeah. Yes, it is scary. I mean, when you first told me what you were going to do, I had to get it in little bits of information. I came back 3 or 4 times, and you would give me little bits of information, and I'd go dissolve that, and then I'd come back. But it's worth it. It's just worth it. That's all I can say.